Hello, this is Dr. Joanne Manson, Professor of Medicine at Harvard Medical School and Brigham and Women's Hospital, and one of the directors of the Vitamin D for COVID trial, or the VIVID trial as we call it. Thank you for your interest in learning about the VIVID trial, which is a nationwide clinical trial being conducted by researchers at Brigham Health and Harvard University. This brief video will discuss the reasons for testing vitamin D supplements for the early treatment as well as prevention of COVID-19, the steps involved in participating in our study, and we'll tell you how to assess your eligibility to join. First, we want you to know that our trial is open to people living throughout the United States and is conducted entirely remotely. It's an at-home study with no clinic visits and no need to travel. We'll send you your study pills and other supplies that you need to participate by express mail. Pill taking will last for 4 weeks with weekly electronic surveys and a final survey at 8 weeks. Why are we testing vitamin D supplements in COVID? Vitamin D has looked promising for boosting our immune system to fend off infections, but it hasn't been well tested specifically for COVID-19. Some studies also show that vitamin D may decrease or tamp down inflammation, which may play a role in preventing severe COVID illness leading to hospitalization. But again, there isn't yet conclusive evidence that vitamin D supplements have these benefits in COVID. Thus, by participating in this trial, you help advance science and help answer these critically important questions about the potential benefits of vitamin D in COVID. Our trial is open to people across the U.S. who have been recently diagnosed with COVID with positive tests within the past week, whether or not they have symptoms, to see if taking vitamin D supplements can reduce the risk of developing severe illness, severe symptoms, requiring hospitalization, ER visits, or other clinical visits. The study is also open to people across the U.S. who are household members, such as a spouse, partner, or family member in the same household of someone who was diagnosed with COVID in the past week, to see if vitamin D supplements can lower the risk of becoming infected with coronavirus. You would be eligible to enroll as a household member, whether or not your household member with COVID is enrolled in the study. Having a household contact is not required for participation, however. Overall, we plan to include nearly 3,000 participants across the country in the 2 parallel studies. For you to be eligible for the vitamin D for COVID trial VIVID, you must be at least 18 years old and diagnosed with COVID-19 infection in the past week, or the household contact of someone diagnosed with COVID in the past week. Have access to the internet to complete study surveys, be willing to provide informed consent, which will be done online using a secure website. Please do the eligibility screen on our website at vividtrial.org as soon as possible. It will tell you if you're eligible. If you're eligible, you'll be randomly assigned by computer to receive either the vitamin D pills or inactive placebo pills. This is a process similar to flipping a coin. Both of these groups are equally important for advancing scientific knowledge, and we don't yet know if vitamin D will be better than placebo. That's why we're doing the trial. You can partner with us to help get these answers on vitamin D and COVID by participating in this trial. We'll also ask you to provide a blood spot collection at home to measure your vitamin D level and other biomarkers, and we'll send you all the supplies you need for this. This would take place at the beginning of the study and again in about 4 weeks. Please look at our companion video link on the website, which shows you how to do this and send the card back to us in the return mailer. As a token of our appreciation for providing the sample, we'll send you a small gift certificate. Thank you for watching this video. We hope you can join us in getting these important answers. We look forward to working together with you, and we send you our very best wishes.